Right, ladies and gentlemen, today we're talking about the anterior hip muscles. All right, so these are going to be muscles that are going to be running from the lumbar spine, the pelvis, and down to the proximal femur. So we have this bony diagram in front of us, which shows us this area, right? And the first thing I want to point out is over here, right? The lumbar spine. So lumbar spine, we're going to have L5, which is going to be the one that is going to have direct articulation with the sacrum, right? So we have L5 right here, and then 4, 3, 2, 1, right? So this is going to be L1 right over here, which means this is going to be T12, okay? 1, 2, 3, 4, 5. Now, another thing that's pointed out on this diagram is these bony projections that are coming off the sides of these lumbar vertebra, okay? And if you've seen my previous videos on the back, you'll know that these are the transverse processes, right? These are the transverse processes. So we're going to put in lumbar transverse processes. Okay. And so remember that all these bony landmarks that I'm giving you are relevant for muscle attachment sites. Okay. So this is the reason why I highlight them for you. Now, next thing we're going to start looking at is this innominate bone. All right. Part of the pelvis. So first thing we're highlighting is this, this long crest that travels over the superior margin of the iliac, of the ilium. Right. So this is what we call the iliac crest. Okay, that's the iliac crest. The iliac crest, as it travels anteriorly, right, and it's coming towards us in the screen, it's going to terminate over here as a point, right? This is known as a spine. This is a very, very important landmark. This is known as the anterior superior iliac spine. Okay, that's the anterior superior iliac spine, also known as the ASIS. Okay. Likewise, we have another spine that is directly inferior to that one right here. Okay. So the name is going to be very similar. It's only going to be one word that changes. So we have anterior, now inferior iliac spine, also known as the AIIS. Okay. Then we see that over here on the bone of the ilium itself, we have this shallow depression on the anterior face of this bone. This right here we call the iliac fossa. Okay, that's your iliac fossa. Next, we look even more distally. We start approaching the pubic bone. And this part of the pubic bone, this small little tubercle right here that's projecting out, we call this the pubic tubercle. All right, that's your pubic tubercle. Then we look at this open foramen over here. Okay, this open foramen is known as the obturator. Tor foramen. That's the obturator foramen. Then we look at the proximal femur over here. Okay, and the proximal femur, one of the two major landmarks that we have are going to be this large trochanter over here on the lateral side, and a much smaller trochanter on the medial side that kind of faces posteriorly a little bit. Okay, this one out here, this is known as the greater trochanter. Okay, whereas the smaller one is going to be, yeah, you guessed it, the lesser trochanter. Okay, that's your lesser trochanter. Then we're going to have this small fossa that is sitting on the medial side of this greater trochanter. Okay, so we're going to call this the trochanteric fossa. Okay, that's your trochanteric fossa. And altogether, these are the bony landmarks that you should know for these muscles that we're going to talk about. So, first muscle we're going to talk about, psoas major. Let me move this over to the side. All right, so psoas major, okay? The attachment sites for the psoas major are going to be on all of these vertebrae, right? So the vertebral bodies, the vertebral discs in between the bodies, and the transverse processes from T12 through L5, all right? All of these 6 vertebrae right here, okay? All of the lumbar and the last thoracic. That's where psoas major is going to start, okay? And then from there, it's going to run down, cross anterior to the hip joint to insert itself onto the lesser trochanter of the femur, all right? So what does that look like? That's going to look like this, Okay, that's going to look like this. So you see that we have the psoas major in place, right? Crossing anterior to the hip joint. What does that mean in terms of its function? That means that it's going to pull this lesser trochanter superiorly and anteriorly to bring your hip into flexion. Okay, the psoas major is a hip flexor. All right, and we're going to talk about it in combination with the next muscles, and we're going to talk about how they all work in concert together. All right, and in case you don't know, hip flexion is essentially the movement that you would do if you want to knee someone in the balls. All right, so just bang right to the family jewels. Right. Okay, psoas minor. Psoas minor is the little brother of psoas major. It's attaching to the vertebral discs and bodies of T12 through L1. Okay, and then from there, it's actually going to run down and kind of like turn into this band that inserts onto the pectineal line over here. So it doesn't really have any function at the hip joint. Okay, it's kind of like a random vestigial muscle that's still there. There are some cadavers that may not even have a psoas minor in place. Okay, so let's see what that is going to look like. That's going to look like this. Okay, that's the psoas minor in place now. All right, now we go to the next ones. So the next one is going to be iliacus. All right, the iliacus is going to be sitting in this iliac fossa over here. Okay, and it's also going to be attaching to this margin right here, the iliac crest. Right, and from this fossa that it sits in, it will also cross anterior to the hip joint and insert itself onto the same location where we found the psoas major inserting onto, the lesser trochanter of the femur. Okay, so what's that going to look like? That's going to look like this. Okay, that's going to look like that. And so together we see that iliacus and the psoas major are going to insert onto that lesser trochanter. And because of that, let me show you something. Because of that, we can conceptually combine, not just conceptually, but even when you look on a body, you will see that the psoas major and the iliacus, the muscle fibers, basically blend together to create one muscle belly right at this point. And together, all those muscle fibers will insert themselves onto the lesser trochanter. And because of that reason, we call both of these muscles in combination, the iliacus and the psoas major in combination, we can consider this one whole muscle that's called the iliopsoas, right? The iliopsoas, okay? And so what's the iliopsoas going to look like when it's attached? It's going to look like this, okay? So this is your iliopsoas now. It's basically the iliacus and the psoas major together. And so what are they going to do? They're going to flex the hip. This is the major hip flexor in the body, okay? The major hip flexor in the body, okay? And you need to realize that hip flexion is a very common movement that is done, all right? And in addition to that, you need to realize the fact that a lot of people in our modern day life live not just a sedentary lifestyle, but also, when we go to school, when we go to work, most of the times, if we're doing office work or whatever it may be, or we're studying in a library, we're sitting down. So when we're sitting with our hip in a flexed position. So what does that mean for this muscle iliopsoas? That means that this muscle iliopsoas, if you're sitting for most of your day, this muscle is shortened for most of your day. Okay, so then when you get up to start walking around, all of a sudden the iliopsoas starts getting stretched out, right? And so what does that mean? If you spend a lot of time sitting, this muscle is going to get very tight. And that muscle getting very tight is going to start applying force onto these lumbar vertebrae. It's going to start pulling on these lumbar vertebrae, squishing them together, making an excessive lordotic posture for this lumbar spine, right? And that can result in lower back pain. So there's a lot of people, young people, I see college students, medical students all the time that complain of lower back pain. And a lot of times it's due to this, really. It's due to this. So make sure you stretch your hip flexors out. And especially if you're a runner or an athlete, it's extremely important to keep this muscle very light and limber. Okay. Next muscle, and this is the last muscle we're going to talk about for this video, is pectineus. Okay. The pectineus is a short muscle and it runs from the superior pubic ramus right here. And then it goes and it inserts itself onto its own little section of the femur called the pectineal line of the femur, which is kind of on the posterior end and slightly inferior to the lesser trochanter. That's where you're going to find the pectineal line of the femur, okay? And the pectineus, when it attaches, is going to look like that, okay? And so I included the pectineus in this section just because it's a good bony diagram to place it on. And it also, look at how it runs. It crosses anterior to the hip joint. I know it's kind of like off to the side over here, but it can still assist in flexion of the hip. And in addition to that, it can also assist in adduction of the hip, okay? Hip adduction. And we're going to talk about the hip adductors in a separate video when we talk about the medial compartment of the thigh, okay? And that's all she wrote for this one. I'll catch you on the next one. Gross anatomy is one of the most difficult subjects in the world. Luckily, it doesn't have to be. Anatomy is one of those subjects that needs constant verbal and visual repetition in order to get good at. What better way to reinforce this information than with the scientifically validated method of drawing? Neuroscience has shown us that we retain information better when we physically draw it out. That is why the Gross Anatomy Study Strategy Workbook is designed to walk you through all the layers of the musculoskeletal system, allowing you to draw the muscles into place. This is excellent for reinforcing muscle attachments, bony landmarks, muscle names, and actions. This will save you tons of time from mind-numbing tactics such as repetitive flashcards or passively listening to boring lectures. With this strategy, you can actually begin to enjoy studying again and have a much better way to retrieve the information. Order a copy of the Gross Anatomy Study Strategy today at the link below so you can spend less time being stressed and more time being blessed.